comments on these items? If not, we'll move to our regular morning agenda. And with that, we have our agenda item 7A, the Inyo County Veterans Services Officer update. And I know we have a guest with us, and I'll hand it over to you, CAO Lawton.
Good morning, Madam Chair, and thank you. Ladies and gentlemen, it's a privilege and a pleasure to introduce Gordon Greene, who is the new Inyo County Veterans Service Officer. Gordon served our country in the United States Navy as a corpsman. He has served his community in various positions, and most recently, before moving to veteran service, he worked in the Inyo County Department of Social Services. The Veteran Service Officer position on the organizational chart in Inyo County is housed within the reports to the County Administrative Officer, and the Mono and Inyo County CAOs are in contact and in agreement about how we move forward with this relationship. It was a distinct pleasure to be able to introduce Gordon to the Mono County veterans community last Friday, along with Supervisor Peters at the Bridgeport Hall. And as I mentioned earlier, we observed all conventions, everyone was properly masked and social distanced, and had been discussed with public health beforehand. And I'm sure this is the first of many visits. So with that, I'm going to get out of the way and invite Gordon to introduce himself a little further and explain to the board and our public the role and duties of the VSO, and to remind everybody that Gordon's presentation will be posted on the county's YouTube channel, and we will also have a link to that from our VSO page on the Mono County website. So this will continue to be up and available for everybody. With that, I will get out of the way. Thank you, Madam Chair.
Well, good morning, everybody. Can you hear me?
Good morning. Yes.
All right,
welcome.
good. All right. Murphy's Law was in full effect this morning. Everything was going wrong with my technology here in the office, and I just barely got everything fixed before this started. So I'm glad everyone can hear me and see me. So yeah, I'm Gordon. I've been in the role of Veteran Service Officer now since March 4th. Seems like something new is coming up every day, something that I don't know. I'm learning from starting from square one, and man, things are just rolling. They're just rolling really fast. So I did prepare a little presentation today. I'm going to see if I can do this. I'm not the best at Zoom here. So let's see here, share. Okay. Oh no, Inyo County Veteran Service Officer. That's me. All right. So dedicated to providing assistance to men and women who serve the United States Armed Forces, their dependents and their survivors relative to federal, state, and local benefits entitled to them by law. So yeah, that's what I'm here to do. I'm here to help out any veterans that need help. I want to reach out, try to find the ones that don't know that their service is out there for them. And I want to bring them in. Unfortunately, with COVID, I can't bring them into the office, but I'll bring them into the parking lot. We'll go out there and talk. And I just want everyone, well, all the veterans to know that they do have a place they can come and see if they, qualify for any kind of services. Okay, so veteran service officers, trained and accredited by VA Calvet. There's other recognized organizations out there. VFW, American Legion, in a lot of bigger cities. Those organizations also have veteran service officers working for them. As far as I know, Inyo and Mono County don't have accredited veteran service officers in VFW or American Legion. in Inyo or Mono counties. I'm not 100% sure on that, but I'm pretty sure. Okay, my certification through CalVet, it's going to start on May 4th, and it comes in 3 different blocks. The 3rd block will end in August of 2021, and at that point, I'll be able to do all the things that the VSO can do. One of the things that entails, just as an example, is the veterans designation on their California driver's license or their ID. That's one of the things I've dealt with time and time again since I started this job. And unfortunately, without the accreditation, I have to take the veterans request for that designation and forward it to Kern County, where I'm working with the VSOs there. And they've been really good about getting back. The turnover on that's just a couple of days. So everything's working out really well. Services and programs that are offered here. We do the comprehensive benefit counseling. I'll let veterans know what services they might be entitled to and what those services entail. I'll help them prepare claims and submit the claims and tracking the claim. Again, a lot of this is done with help from the veteran service officers in Kern County. Requesting discharge documents. If a veteran loses their DD-214 or their service record, I can help them get a copy of that, certified copy. The college tuition and fee waivers. Some of these programs not 100% familiar with. This one right here, I've had one experience right now where I'm trying to help the daughter of one of the veterans go through nursing school. Oh, there's the veteran California driver's license. Information and referral for employment, public assistance, VA medical care. This is also something that I'm learning. I actually had two inquiries about any kind of employment programs. I don't have anything set up yet, but I do have resources through Health and Human Services, which offer employment programs. So coming from Health and Human Services, I'm able to reach out to them. More programs, compensation or disability claims. That's a lot of what we do here. People hurt themselves while they're in, and years later it starts to bother them. So they come to me and see if there's anything we can do about that. Dependency and indemnity compensation. That's for veterans dependents. They need education assistance, and the veteran died during combat. That's for them. Aid and attendance. Another thing that I'm working on. I'm learning all these programs like from day to day, and it's really awesome. Aid and attendance is for helping veterans who can no longer really take care of themselves at home. So if they need somebody to come in, we can go through the VA and help get that care paid for. VA loans, home loans. I haven't had to deal with that yet, but it is something that I've been reading about, and I can really help if the veteran comes to me. Life insurance. I haven't dealt with that one yet. Nobody's come to me for any life insurance. Military records, again, I can help them obtain those military records as well as their discharge upgrades and any kind of record corrections. State veteran homes, really haven't had to deal with that yet in this county. Any questions veterans may have concerning benefits as a veteran or veterans dependent? My phone really doesn't stop ringing. Like I said, it's just nonstop. I actually unplugged it for this because we've been interrupted a lot. Problems with alcohol, drugs, suicide. Thankfully, I haven't had to deal with any of that yet. And group therapy and peer support. I have looked into this because I've had a few calls. As far as I know, in Inyo and Mono County, there's no peer support groups that meet. So that is something that I would like to get together very soon, actually, so that a lot of combat veterans can get together and have somebody to talk to, other people that understand. Okay, so for veteran outreach programs, because of COVID-19, the outreach programs, they remain suspended at this time. Some of the ideas that are being discussed and developed in order to minimize the downtime once programs are green-lighted again are up-to-date veteran mailing list or email list from the VA. I want to contact the VA and see if I can get an up-to-date list of veterans that are in Inyo and Mono County. It'd be nice to just have a list on hand. Participating along medical rural outreach programs. This is something I spoke with in the south end of Inyo County. I spoke to the CEO of Southern Inyo Hospital there. And one of the things they do is they do an outreach program in the rural counties like Darwin and those small towns like that, where they'll actually send out like a little medical RV. So I'd like to kind of piggyback on that and set up you know, a little veteran station next to them. And I might be able to reach some veterans where I wouldn't have known about them otherwise. Again, there's the combat support groups. The monthly senior center visits to talk with veterans. I'm already doing that. That's why there's a little asterisk. The Southern Inyo Hospital, they have an acute care center connected to their hospital, and they have roughly 8 to 10 veterans in-house there. So I like to stop in and talk with them, see if there's any needs that I can help address. And monthly visits to rural areas in Mono County. That's something that I had discussed with Mr. Lawton, and it's something that's in the works. And I can't wait to get out to those little counties and speak with those little towns and speak with the veterans. Okay, this is my contact information. Right now, the best way to reach me would be either the office or cell phone. I don't really have a number yet for an office in Mono County, but that's something that's in the works. So if anyone needs to get a hold of me, got that. And that's all I got. That's what I got for now.
Thank you, Gordon.
Yeah.
Appreciate that update. I'll hand it over to CEO Lawton. Was there anything else, or should we go to board comments and questions?
I think Gordon's pretty much said it all, and certainly welcome questions and comments from the board, or if there is anybody listening who would like Gordon to reach out to them, we'll find a way to get them connected. And thank you.
Absolutely. I'll turn it first to board and then public comments. Are there any board comments or questions for Gordon? Supervisor Gardner?
Yes, I just want to say thank you, CAO Lawton, and thank you, Gordon, for your comprehensive presentation here. This is exciting, and I think, you know, long overdue, and it's fantastic that we're getting this to a higher tier in terms of our service to our veterans. And you know, we say, I believe, correct me if I'm wrong, that there are about 1,200 veterans in Mono County. Is that correct?
That's my understanding, yeah.
But as you pointed out, when we begin to serve veterans and their dependents, that number grows. And that ranges from certainly spouses and others that are connected to a veteran, and also young children and youth. And so a lot of them are eligible for veterans programs, and that creates an even larger workload for you. I would encourage you to, and I'm sure you've thought of this, but work with our obviously public health, behavior health, and social services departments, who certainly serve our residents as well and can connect you with programs that may be available for veterans and others. But thank you very much. I like your enthusiasm. I hope you're not overwhelmed too quickly. And if you are, put up your hand, and obviously CAO Lawton will reach into the magic bag and come out with a solution. But thank you, and I look forward to hearing greater and additional progress reports. Thank you.
Supervisor Peters?
Yes, Gordon, good to see you again. And it was great to have you come up to Bridgeport, and in pretty short order, the local veterans community was notified of your pending arrival, and they rallied. We estimate that about 50% of the known veterans who were physically here on Friday and not a second homeowner or had the inability to actually make it to Memorial Hall attended. So I consider that a huge step in the right direction. Progress was made. I think the discussion after you left amongst the veterans was positive, and you did a great job. You answered the questions open and honestly. You told them about yourself and your background, and you got a chance to hear about each and every one of the veterans. And there was actually a gentleman who had a kind of a tough experience. He wasn't a veteran, but he had to deal with his father-in-law who passed away and was a veteran. And really, I think this is an amazing opportunity for our veterans community and for you. I mean, this is a chosen path that you want to be on. You were serving our county, our region well, and helping to connect people with services in a different manner. But I really walked away with a great feeling. It was really the first in-person, event of any sort that we had. Our Mono County Public Works Department set up the Memorial Hall in a safe manner. Everyone was, I think, very, very patient and waited for their time to speak. You heard them all out, and I just want to encourage you to continue to try to come up to these outlying areas and meet the veterans. Send us up some more business cards if you could. That would be great. I ran out in short order. Our CAO came up to the Lions Club meeting that was held the following day, again in a safe manner with a dozen or so members, and talked about your presentation and about your new role. So we look forward to just having more and more engagement, and we will get you the roster of veterans here in North Mono County, and I'm sure throughout the rest of the county. And I did meet separately with the colonel, the commander of the Mountain Warfare Training Center, on Saturday, and he has at your, when your schedule permits, if you can make your way up to our area again, I will take you up to the base, introduce you to him and his staff, and have lunch or something like that. And so he's excited to meet you and help integrate, whatever veterans a lot of veterans work up there, and some live in the area, some don't. So lots of opportunities for you. And I'll echo what Supervisor Gardner said. Don't hesitate to ask for help if you're feeling overwhelmed, and then we'll ask Bob Lawton to deal with it. No, thank you though, very much.
Supervisor Corliss?
No questions, just thank you so much for this presentation. And I just wanted to note I talked to CAO Lawton about this, that the presentation today, of course, it's recorded as part of our regular meeting, but our county administrator is going to make sure it's available also as a standalone and is on the county's YouTube channel, so that we can share it around and make sure that everyone's aware of the services offered and this really remarkable and applaudable effort to get out to outlying county communities and really connect with our veterans. So thank you very much.
Supervisor Dugan.
Thank you, Chair Kreitz. Gordon, welcome. I've been really looking forward to this. District 2 has a lot of veterans and interest in what services are available. You provided exactly the information that I needed to connect, and looking forward to accompanying you on the road trips when you come out to our area, as well as working with you to find help with these other agencies that can connect to these services, especially with those of us dealing with aging family members and realizing that these services are available, because there's not a lot of knowledge that they're available. So we won't bombard you all at once, but this is the information we need. Welcome aboard and looking forward to working with you.
Well, I think you've heard from everyone. We'll see if there's any public comments, and then I'll wrap it up. Queenie, is there any public comment?
I don't see any hands raised.
Okay. Well, thank you. I echo the sentiments of all my colleagues today. We have been chomping at the bit on getting your services back into Mono County, the veteran services back into Mono County. So it's no wonder that you were met with such enthusiasm in Bridgeport, and please do come back to all of Mono County and we'll help any way we can. I do think it's a great idea that Supervisor Gardner had, and I'm sure you've already done this, but working closely with our Department of Social Services Director, Kathy Peterson, and Behavioral Health Director, Robin Roberts, to connect veterans both ways between the two of you and coordinated services. It's such a important component to what everyone does. So thank you, and we'll look forward to hopefully hearing from you on a regular basis. Please come back.
All right. Thank you. Thank you very much. Thank you for your time. I look forward to meeting you all in person one day. All right. Have a good day, everybody.